colleagues and coworkers. It's your favorite nurses from the Two Bad Nurses podcast. I am Yomi Richardson.
Hi, I'm Lisa Heath. How's
Lisa, what's
everyone
going on?
doing?
How are you doing?
I'm good. Just lost my earring. How are you doing?
Doing good. How was your week?
Busy, the usual.
Busy.
Mhm.
Yeah. Anything stand out from your week?
I've had some interesting things at work, but I've also had some personal family things with, sick people, friends, and things that are dealing with illnesses and whatnot. So it's been a little rough, but been there just trying to support my friends,
Yeah.
going through hard times. So
It pulls on you emotionally. And what I found, I can eat sweets anyway, but what I found is that I'm an emotional sweet eater. And to where I put on like almost 20 pounds recently. Yeah, when my brother passed, when my dad passed, like I went from 150 to 172.
girl, don't look it.
Sweets. I'm down to 160 now.
Well, I don't, when I get stressed out, I can't eat.
hmm
I just can't eat. So losing weight isn't always a good sign. It might mean I'm going through something.
Yeah, wow. Yeah, no.
Yeah.
See, it's funny how we respond differently. Yeah. Well,
Yep, yep, yep.
that's okay. Well, glad you it I know we're dealing with a heat wave out here and y'all had a thunderstorm there. How's your Wi-Fi?
Yes. Yeah, Wi-Fi stable for now. I think there's probably 120,000 people still with no power.
Mm.
And yesterday, a lot of Missouri didn't have power, and some parts of Kansas. But there was at one point, I think the highest was 180,000 people were out of power. So it's been high winds, trees everywhere, trees all in the streets and falling on cars. It's been bad, but it did lower the temperature. Last night, it got down to like 65 degrees.
Oh, that's nice. But
We
that's
haven't seen that. Yeah. So what are you guys at, about 105?
yeah, easily 100, seriously, like 105. And it's blazing. You see, I'm darker, and this is with sunblock, and then I wear hats, so I'm not out here like that. But it's been hot,
Oh, it's
extremes in the weather out
yeah, in Arizona too, I've heard.
here. Mm-hmm.
117 degrees and things like that are happening on a weekly basis. So it's not pretty.
Yeah. Well, global warming, yes or no, depending on what you
I
think
don't
it
know
is.
what it is, but it's hot.
It's hot. It's hot and stormy.
Definitely hot.
Okay, well, we're gonna jump right into it. What's the topic for
Okay. So today I wanted to talk about the new hydration craze that's going around with these new hydration clinics that are popping up. I know that you said there's a couple out there. We have them everywhere in the Midwest, and it's trending. It's IV fluids, IV vitamin infusions. They're calling it IV vitamin therapy, different things for different reasons, all reasons from a hangover to curing fibromyalgia, they say, or helps with the symptoms. So we'll just start by kind of talking about what is IV vitamin therapy. And it introduces vitamins into the body intravenously to address a deficiency or a physical condition. Disorders that may necessitate an IV vitamin treatment include anemia, diarrhea, malabsorption issues, and damage to the intestines. So in those cases, most of the time you're going to be seeing your doctor. They're going to be ordering IV infusions via the hospital or an infusion clinic within the healthcare setting. These new pop-up kind of IV infusion places are separate from that, and they're not FDA approved. And they are not usually covered by any insurance. So it's something that people are choosing to do on their own that helps them feel better, or they believe that there's some benefits to it. A lot of the research that I've looked into, I don't see a lot of downside to doing this. If it makes you feel better, I think people have the right. The one thing is it is expensive and it's not covered by insurance. So if it's something that you can get from your healthcare provider, is it worth it? And is it doing what it says it's going to do? You know, is it really helping you with whatever condition you feel that you need it for? I can tell you for hangovers, it works.
Mm.
Vegas, if you've been to Vegas, you may have seen the buses out there that have these IV places that you can do. Most of us know most of being drunk and the hangover portion of it is dehydration, you know. And so hydrating yourself quickly is going to make you feel better quickly. You can get the same results eventually drinking Propel or drinking Gatorade or hydrating yourself, drinking Pedialyte, getting electrolytes. The thing about it is when you're in Vegas or somewhere that you're there to have fun and you don't have a lot of time, it's time saving. Just give me the IV. Let me be done in, 30, 45 minutes. I'll pay for it and I can go back to partying. So it's all a matter of what you value. If to me, if I'm in Vegas, I'm going to pay for it because I'm only in Vegas for 3 nights. I'm there to have fun. If I need to go do my IV therapy to make myself feel better and keep going, I'm going to do it. But if it's something that they say, a lot of the ones here have memberships. Oh, if you have fibromyalgia or you have MS or you have something, this will help you feel better. Get a membership that's $90 a month. And then you get a discount on your infusions. Maybe they're only 100 instead of 200 or 300. And you will feel better. These cocktails will make you feel better. I wouldn't do something like that because the evidence and the research and the studies that have been done haven't proven that. Yeah. Well, so what do you know about the places in your area?
So Lisa, when you brought this up, I had heard about like the IV hydration, and definitely when people are drunk, you hear people joking like, oh, I'm gonna go get an IV and get some fluids. I didn't know too much about it until you actually brought it up and started talking about like what this really looks like. So in looking at it, I did see that there were actually 2 clinics out here, but so I guess from looking at it from a clinic standpoint, the 2 major clinics that were out here, when I went to their website, one of the first things in looking at the organizational structure of the clinic was they had the doctor who was covering the clinic. And this was now just for one of the clinics. So they listed a doctor, they listed a couple of RNs, they listed an esthetician because they offer other surgical procedures as well, like laser hair removal, Botox, skin resurfacing, and that kind of stuff. And then they listed a patient coordinator. So, for us, we're looking at things through a nursing lens. That's what we keep saying on our channel. And so when I was looking at it, immediately I went to their bios and I'm looking for credentials, like what is your background and training? Some of the nurses, it said bio coming. And for me, that was a red flag. Like, what do you mean bio coming? Like, you're an active website. And on one of them, you have the chief financial officer. And her profile is on there saying how she used to be a former patient and now she's the chief financial officer. So the CFO, who's not providing direct care, has her profile up, but the registered nurses don't. So that was a red flag for me. And then the ones that did have a profile, it was very fluffy, just kind of like been a nurse forever and, has diverse experience. Well, 2011, no knocking, that's not forever. I feel like we've been nurses forever since 1996. Like,
in the 90s.
I'm telling you, but so the red flags for me was the missing bio. There was no resume or, citing what their education, what is their education or what is their training? And then also you would think that, especially in this day and age, that you would put the license on there to say licensed for the esthetician, to say, like even on your truck, licensed and bonded, and they'll have the plumber will have his license number on the truck and say licensed and bonded, but they didn't have any of that on there. So that was kind of a red flag to me.
Yeah. Well, another huge concern is I know that the FDA was looking into, and I don't know if this is why they're not FDA approved or not, but they don't know if the infusion suites where they're actually compounding and adding the medications are in a sterile environment using sterile technique.
Mm,
which is what's usually done when these things are done in a pharmacy.
mhm.
So I think that's something that that people need to look into as far as picking the clinic they go to, what staff is back there actually adding the medication. It's for me, the other risk that, and I've seen one thing that I saw, and which I've always thought about this, is that you don't know a patient's lab values when you're going in giving them certain vitamins and things, and they fill out a questionnaire, but how many people actually know their lab values when they go in?
Right.
Unless they have a chronic condition that they're consistently every 3 months or so monitoring their labs, how do you know? So if you come in and they say, we're giving a special on vitamin D injections, it's extra $5 if you want to add that. What do you do if you have an extremely high vitamin D? You don't know it, but you're like, that sounds good, just add that. There's a possibility that you can be getting over the recommended daily intake of the vitamins, or the nutrients, that because you just don't know. The other issue is congestive heart failure and risk of fluid overload. If you get fluids too fast, it can put you into something called fluid overload, where your body is not processing that fluid out as fast as it's coming in, and it can build up in your lungs and things like that, and give problems such as difficulty breathing and just water retention. Basically, you're going to be swollen. So those are things to watch out for when you're getting these fluids on your own without really a doctor monitoring it. You're on your own. It's kind of almost like a boutique where they're giving you what you want and you're paying for it. And I think they call and check on you afterwards. How was your infusion? They put you in a nice massage chair. It's great. But it's more, I think, a lot of people are doing this as it's a new trend of making them look better and feel better. And I don't know if the science is there to prove that it actually does what it says it's going to do.
Hmm. So I agree with you in terms of, so the financial component, again, with that first IV clinic that I was looking at, and the fact that they had it was literally the medical doctor and the chief financial officer right there, and that's who led the bios. That was what you're showing me what you're here for.
Yeah.
Which literally money is driving it. So with that second IV clinic, this one was actually, they had a doctor and then they had an NP, and they were saying that, I guess according to their business model, that it required a physician's order before they would administer any of the different cocktails that they had. But you, as the consumer, you didn't have to get the order. They would work on it. And they were given, so here's a list of some of the things that they were giving. Nitrate chloride, vitamin C, B complex, B12, zinc, mag, calcium, manganese, copper, acetyl L-cysteine, and then they had different kind of, again, products. They had a beautify product, a hangover cure, this NAD, and some of the language with that was, it's the easiest way to time travel. So literally, this is how they're selling it to you. And then they said that it can reverse the signs of aging and turn back body clocks, minus the 2 or 4 hours spent receiving the infusion. And so what immediately came to my mind was, remember that movie, Death Becomes Her?
Uh-huh.
Remember Goldie Hawn and who was the other one?
I don't know. I don't remember. It's an older movie though.
The Potion with Bruce Willis.
Yes.
There. But if y'all haven't seen it, go look at it. But it was almost on some Death Becomes Her type stuff. And I was just like, wow. And like you said, in terms of the price, like this isn't cheap, $249, $299. And with this NAD infusion, the one that again is the easiest way to time travel, they recommended that you get it twice a month. But each treatment was $600, $599. So we're talking about, for it to be maximally effective, $1,200 a month. And then that was only for 500 mLs. But if you wanted a liter infusion, it was $900, and it takes 4 to 6 hours to administer.
Yeah, see, I've been to one of these clinics.
Mhm.
I wasn't feeling well, and it was a weekend, and I knew I needed IV fluids. Just being a nurse, when you have had the flu or you have vomited a lot, I know when I need fluids. And I refuse to go to the ER. Refuse. On the
Mhm.
weekend, I'm not going to the ER. Well, it was like a Saturday, and I saw one of these clinics that was open. Let me go in and see. I went in, and I said, I just don't feel well. I'm dehydrated. They gave me a paper to fill out my little history, which is like a paragraph, my allergic to any medications. And then they give me a menu of, well, what do you want to pick out? There's this cocktail and this one. This would be really good for you. This gives you energy back. There's B12 in it and all this stuff. And we're running a special on some vitamin D if you want an extra injection of vitamin D. Because I know my labs, I went ahead and got a vitamin D because I know that I chronically run low. So I thought that'll help me. And it did. I felt so much better after that 1,000 milliliter normal saline was all it was. They added some B12 into it, and then they gave me an injection of vitamin D.
Mhm.
I felt so much better.
Mhm.
And so, I mean, I know it works, especially if you have the flu and you were dehydrated. If I went to the ER, that's what they would have done. They
Mhm.
would have done the same thing, and it would have been covered by my insurance, and I would have left.
Mhm.
But because I just refused to go to the ER, I paid out of pocket 200, I think it was $200. I got a special. I might have got a discount for it being my first time.
Mhm.
Um, and I got to lay in this relaxing massage chair that massages you all over and just, oh, it was so comfortable. It's way better than the ER. I'm like, this is the life. It's like you're in a spa.
Yeah.
So if you're there for that specific reason, I mean, I feel that there are certain circumstances where and if you have the education and your health record and you have the background you feel comfortable going. There's nothing wrong with it if you can afford it. It's not
Yeah.
cheap though.
Yeah. And you know what, Lisa, we definitely not here to mess up these clinics' money.
No,
Not that this,
no.
that we can do that here on this podcast. Because now that I'm thinking about it, when we go to the ER and we check in, the nurse may come in and connect you to some IV fluids based off what you're complaining on, and you haven't necessarily had blood drawn. And how many times have they given the antibiotic before the blood cultures were taken? And
Mhm,
it's like, oh,
mhm,
it's kind of invalid. So we not to be disingenuous, but I think the red flag is one, it's a business model. And
mhm.
that's one for profit, which somebody could argue, so are hospitals as well. They
Yeah.
are. But that lab component and that monitoring component, because how we know as nurses, how we administer things matter in
Mhm,
terms of kind of their efficacy, their half-life, of that whatever it is that we're giving ourselves in the body. And what was it called? The synergistic effect that things can have that are given. What other medication are you taking? So it almost sounds like it's not a complete health history that they're inquiring. Are you
mhm,
taking any other medication? Something that could interact. And then not only that, but as the nurses who are there, it's not reassuring in not having a bio there, or the bio not saying that, okay, we're critical care, or we have this background, or we've been in this infusion therapy business for X amount of years, so we're trained to spot consequences and
mhm.
that could go wrong. It's not there. And then for
Right.
people, like you were mentioning in terms of heart failure, I'm thinking about dialysis patients. Dialysis patients, especially our younger ones, they may go out and drink, and now, they may miss a treatment, and now, hey, let me go get this hydration kind of thing going. And they're really good about knowing, like, okay, I only need, X amount of fluid. But still, it's a lot that's being left to chance.
Yeah. And
Clinics are not
it,
addressing.
well, but not only that, we give fluid boluses in the hospital to raise blood pressures when
Yeah.
someone's bottoming out. So I know that when she checked my blood pressure, it was normal.
Mhm.
but I don't know if they knew what my history was. So when I said, hey, I've got to get to my daughter's basketball game, I need to hurry up. And she came and put a pressure bag on it and bolused me. Basically, she bolused me because I was done in 15 minutes when
Mm.
I still had 30 minutes or 45 minutes, left.
Mm.
That could have spiked my blood pressure, you know?
Right.
And so it's things like that that if you weren't a nurse, you wouldn't think about it. If you weren't in the medical field, you wouldn't even think about, oh, good, I get this done. You know what I mean? Like you don't think about that. But how many times in the hospital have we put a pressure bag on for a different reason? We've got someone in a Trodelberg position, halfway upside down,
Right.
putting fluid in them to keep them alive, to keep their blood pressure up.
Hmm.
And this is something we're doing a pressure bag for my convenience.
Yes.
You got a satisfied customer out of it. I was
Hmm.
happy. I got out of there on time. I wasn't late.
Hmm.
If I wasn't a nurse, would I've even thought about that? No, I just would have been happy. But the nurse part of me as I left thought that was kind of dumb.
Yeah.
Why'd I do that? I could
Yeah.
have just been late for the game. You know what I mean? Like
Yes.
those are things that we just don't think about. Now, I was reading too in the Washington Post, I found this article, and it talks about John Myers of Baltimore in the 1960s. He developed the Myers cocktail, which is a popular formula, and almost all of these clinics have the Myers cocktail.
Hmm.
It's named after him by a colleague. It's a method to treat conditions such as asthma attacks, migraines, and fibromyalgia. A clinical study of the effect of the Myers cocktail on fibromyalgia patients found some improvement, but no statistically significant results.
Hmm.
So it's kind of like a lot of things that, it could help. It doesn't hurt,
Yes.
but are you getting what you are paying for that's not covered by insurance? You
Mm.
can try a lot of things within the scope of your practice of the physician that you're seeing that's going to be billed to insurance, and you'll have a copay. Is it so significant that you want to pay out of pocket? For me, it needs to be very significant for me
Yes.
to pay out of pocket. It talks about vitamin infusions have been very popular recently with celebrities. Chrissy Teigen, Gwyneth Paltrow, those are ones that can talk, that have said how these infusions cure hangovers, boost energy. I mean, everyone is talking about how great it is.
Hmm.
So again, if it's something that makes you feel better, and like I said, if I'm in Vegas and I get a hangover, I'm going to go to the bus. I'm going to get my IV infusion. I'm going to just budget that into my vacation.
Yeah,
My
definitely.
vacation dollars, because it's worth it for me. I don't have a lot of time.
Yeah. And people definitely will. They'll
Mhm.
make that part. In this one here, this NAD, this one that's supposed to make you time travel. But some things about it that I kind of found, which was actually kind of funny, is the research on this NAD was carried out in animal models. So, clean beauty people, PETA people. This may be a problem here because now
Mhm.
we're talking about, again, almost $1,600 for the recommended,
Right.
amount. So that's cost prohibitive. So who is going to that? So you're receiving something that's not clean. So it's been used by PETA, because PETA would have a problem with it because it's only been carried out in animal models. So the outcomes have been translated to humans, as we know, but it's animal model friendly. And within that setting of infusion therapy, which is how it's being promoted, the infusion of that NAD, the study that I read said more research is needed for the
Mhm.
efficacy of this thing. We suspect that it could be helpful because we know that NAD in higher concentrations is helpful at reversing signs of aging on a cellular level.
Mhm.
More studies are needed. So
Mhm.
the claims that they're making here is that it can reverse the signs of aging is not necessarily true, because further research is needed in humans to make the
Mhm.
claim valid.
Well, I think it's all in the way they word it.
Yes.
It may.
And mm-hmm.
Those kind of words, a lot of things can happen. A lot of things may happen.
Exactly.
Is this is it more likely than not to
Yeah,
happen? That's I need some better, it's like, I need some reviews on this, people who've done it, and um how they've how they think that the outcome, is it worth it? Like, are they seeing a difference? Is it just that their skin looks better that day? I mean, I can go get a facial and my skin looks better that day.
right.
Is it really long term? Is it helping? But the other thing is the explosion of all these trendy drip bars or prime hydration spots, that they're also coming at a cost of what some say is medical needs of people that are in the hospital. For example, there's multivitamins, electrolytes, sterile water, amino acids that appeared on the FDA shortage list when there was a pandemic related supply chain issue. And so there's a lot of critical shortages in ICUs on meds. Every week we get a memo at my job of what's the shortage at the pharmacy.
Mm-hmm.
And so when these things appear on the shortage and you're taking away from things that are absolutely necessary in the hospital,
Yeah.
fluids, things like that, then that's disturbing to me, to for just it to be on a at a clinic, somebody who wants to go get it. I remember the IV fluid shortage.
Yes.
I remember, and that's serious. Just like the ventilators, when COVID was going on and there was a shortage on ventilators, a shortage on IV fluids, and oh my goodness, the things that everybody was going through to get these things. And so I just hope that, and like I said, I know it's not FDA approved, and I don't know where they are in the supply chain, if they are given the same, access as the hospitals do, or if they're kind of a step down, if if the places have to prioritize, what is it, Baxter or whatever the companies
Yes.
are,
Yes.
that have to send it to the hospitals. I don't know enough about that information, but I would just say that when things are running low, we got to really make sure that it's going to the things that we absolutely need.
And Lisa, I recall we're literally thinking the same thing here, because I recall reading an article on Medscape, and it was specifically talking about how drugs are obtained from various people. So it's almost like, if I recall correctly, it's like the hospitals have a priority, the pharmacies have access, these clinics, because I think it was in relation to the COVID vaccine. And it was saying, just in terms of how are people getting these vaccines kind of in quantity, to now
Mm-hmm.
where it's now pulling away from other people. And so that was the purpose of the Medscape article, was to show that other entities, whether it's a physician, whether it's a pharmacy, whether something like Walgreens or CVS or your mom and
Mm-hmm.
pop pharmacy, there is a way for a provider to get medication. And it was linked in terms of billing as well, and their
Okay.
ability to charge. So there's a way that they
Okay.
can absolutely attain it. I was just thinking about that as you were saying it. And the other thing is that I think, to make it real for people, when you're talking about like the ventilator is not there, the IV fluids are not there, we've talked about it being a heat wave out here in California. And let's just say, like, your grandmother, gets dehydrated in her apartment and she now has to go to the ER, and there are no IV fluids, or we can only give her 1 liter because there's a shortage of IV fluids. And we've all heard about, the blood shortage, to where we can't give people blood. Well, if you're bleeding out, if you're a trauma patient and you have some kind of internal bleeding, we're all driving our cars. A lot of us are. God
Mm-hmm.
forbid, you're in an accident and you're internally bleeding. And now we can only give you 1 unit, or we're having a ration because there's a blood shortage now. Either people aren't donating or it's being given inappropriately or whatever. But it does matter, and especially for these young kids. Even, where I work now is close to a lot of fraternities and sororities, and the young people come in, intoxicated over the weekend. And so we have to now give them IV fluids, put, the banana bag, all those different IV vitamins and additives. Remember, trace minerals.
Yeah.
Turn the fluid a different color
Yeah.
to now give that to them. And it may take, a liter or two, but if we're having to ration, because these kind of clinics are now siphoning away, the resources, same way like Ozempic. to where you're diabetics. Thank you for reminding me on the name. The diabetics who need it, who it's targeted for, can't get it, or their access is now being limited because people are using it for weight loss.
Yeah, it's kind of a double-edged thing for me, because I agree it definitely should go to the diabetics first, but I think that Ozempic has had such a wonderful outcome that the studies have shown how much weight loss people have had, which we know that's going to lead them to not becoming a type 2 diabetic.
Yes.
Because they have weight loss. It's preventative.
Yes.
We talk about preventative all the time, and this is preventative. Mm-hmm. So I think what we just have to remember is that people who are already diabetic, they have to take priority over preventative.
Yes.
So if there's an elective surgery that's scheduled where you have a biopsy or something that you're going in to get something looked at, but somebody else already has a surgery scheduled that day to have a colon resection because they found a mass, that person's going to go before you, or yes. They should, so that's how we have to look at it, is that the Ozempic really should go to the people who are already dealing with comorbidities of other things. You know what I mean? Diabetes is a big thing amongst people that cause several different kidney disease and kidney failure and all kinds of things that with diabetes. And so they've got to get priority when there's a shortage. Then we can look at preventative, because I think preventative is the way to go.
Yeah, and it's kind of unfortunate because we have our, celebrities, and a couple of them that were trending. One of them in particular from the Real Housewives of Beverly Hills, like she was already skinny. And so it was rumored, allegedly, she was taking the Ozempic. And so you have people where there's not necessarily a need, but they have the resources to pay for it. Same way with the opioid crisis. Physicians with prescriptive power that are willing to prescribe these medications, getting kickbacks from pharmacies, from the manufacturers themselves, and even in terms of the deceptive marketing with that whole Sackler family, very criminal. I don't know why they weren't incarcerated for what they did if you look at it, and people died and have suffered. But it's almost like this disproportionate, like definitely, the need should go to people who have it, and then, from a preventative standpoint, but
I mean, do they have a need, or is this just a cosmetic want? You know what I mean?
The ones that's been trending.
Right. I feel like people who need to lose weight, who have struggled, they've tried phentermine, they've tried all these things, doesn't work, and this works, go for it. I mean, because if you can prevent yourself from becoming a type 2 diabetic, if you can lose the weight, get off cholesterol medications, you're going on the path of health. If you need to lose an extra 5 pounds, it's not what it's for.
I'm telling you, girl, what did I start this thing off saying? Like I got to 172 and now I'm 160. Like I stopped eating sweets and I exercise.
Right.
But now all these next 10 pounds, let me go get some Ozempic.
Yeah. And you can do it.
Knowing that it's taken away from people who are diabetic. It's like, but then for me, I'm gonna get on Ozempic and then still be up eating at 10 o'clock at night for salted caramels.
Right.
Because it's going.
Right. I mean, it's just the way it goes. I mean, and we just have to be mindful of it. There's always going to be opinions about any of this stuff, but that's why we do this podcast. That's why we talk about these things, because we can talk about everybody's viewpoints, and we can share ours, and it's not necessarily going to be the same as everyone else's, but it's good. We learn from it. We learn, when people have their rationales for why they feel a certain way, and hopefully they learn from us just where we're coming from, on why we feel a certain way on things.
No, I definitely agree with you. Another thing that you had mentioned was the healthcare setting. So receiving IV fluids if we go to an ER emergency. But I was thinking of, in my role as case manager, as a home health nurse, like home health, we connect patients to home health. Like administering IV fluids is part of that, but it has to be that physician oversight and somebody that's going to follow these labs. And for these clinics, it seems like there's a little bit with the one clinic the second clinic that I looked here, they mentioned an MD and a a nurse practitioner, and the nurse practitioner looks like he or she comes to your home. So they're going to meet you where you're at.
That sounds like a level up on these clinics, because where I went, it was just a hydration place and they don't monitor your labs, and you get a call the next day just to say, how did you enjoy your stay here?
Mm-hmm.
It's more customer service,
Mm-hmm.
but there's no one that's monitoring anything. There was no doctor's order.
Mm-hmm.
The nurse went back and mixed it herself.
Mm-hmm.
So it was no doctor's order, and they're not monitoring. They're not saying, oh, what were your labs? Did you go to the doctor? They're not even asking verbally. It's not being monitored. The place that you're looking into sounds like it's more of a wellness type clinic that does more than just these type of hydration things, and they may have those extra levels.
Mm-hmm. That's what it looked like. That's
Mm-hmm.
what it looked like. And Lisa, when you were talking about compounding, people
Mm-hmm.
compounding, like what more can we say about that?
I
Even from
mean,
an infection standpoint.
right. It needs to be under a sterile environment. I mean, I'm
Can I
keeping,
say something? Remember,
yeah,
we would be mixing.
that's what I was about to say. That's what I was about to say.
Yeah.
We used to mix our own drugs in
Remember,
the room. Yes.
but
And
we were
that's
serious. Remember how serious we took that?
yes. And you just knew, like, what was it, 400 milligrams of dopamine for 250 of
Yeah.
D5, or I mean, you just remember
Shaking
but
the bowel. Remember we shaking the bowel and making.
yeah, like I can't believe now. I look at the nurses now, and they're always waiting on pharmacy, just a bag of saline with
Yeah.
20 a K. I'm like, we should just throw that 20 a K in there. Like, it's different now.
Yes.
So different now. So now, there's certain standards when you are compounding or mixing medications, adding medications to others. It needs to be done. There's like under a sterile hood, or
Mm-hmm.
just in a sterile environment. Are the fluids open, not open? Are they sterile when you're opening a sterile needle to inject it
Yes.
with whatever? There's a lot. And I'm assuming,
Remember the filter needle and the crystal?
yes,
I can't even remember what medications, but remember so
yes,
needs a filter needle and
yes.
looking for crystals. If we didn't mix something and it crystallized, we had to throw it out and do it again. Like,
That was when, yeah, when it didn't, when it was non-compatible.
right.
And I remember the first time I ever had somebody with propofol, and you know how it's white. And
Yeah.
we had some fluids, and I saw this white. I'm like clamping it off, because that was always the sign that something's not compatible. If
Right.
it turns white, and I'm
Right.
clamping it up. No, propofol's white. It looks
Yes.
like milk.
Yes. It's milk.
So, I mean, yeah, there's things have changed, but there's certain standards now that when you're doing these things with medications, it needs to be clean environment. And I've read somewhere, I don't want to even get to lying about it, because I don't remember the details, but there was something about that was one of the reasons that things weren't being FDA approved. They found certain places were not compounding or mixing the drugs right.
Mm-hmm.
And I don't know if it's one clinic or 3 or 5, I don't know, but I read that somewhere. So those are things that I think are important. When you look at this, all in all, it is not something that I think is going to harm anyone, really, really. Besides the chances, there's a small chance of the fluid overload. There's always a chance of infection when you do an IV. There's always a chance that you'll clot, in the vein, and that's always something that could happen. There's a chance that you'll get over the recommended daily values of the nutrients and the vitamins, and you can have some toxicity, but there's only certain vitamins that actually are toxic. So all in all, the risk, I think, is very low for anything bad and detrimental to happen. It's just a matter of the cost and how you can get it somewhere else without paying this cost.
Yeah. I think as you're talking, a couple of things that came for me is, if I was either an investor in one of these clinics, or if I was definitely a nurse working there, what kind of data tracking are you doing? I would absolutely, say, hey, y'all, let's, and they may be doing it already.
Right.
In terms of, if nothing else, our client population, like people that are coming in and what they're telling us. If they're telling us that they're healthy, if we're doing more of the hangover cure, therapies, if that's kind of what, and I'm sure they have that kind of data in
I'm
terms of
sure.
what's leading, but also with that is their client population. And I think to reassure us who are nurses, because you went, I'm not saying that I'm opposed to going, I wouldn't mind, but I would like to know the credentials of, what it is, if I'm looking it up to see, okay, what is your training? And us, we're always worried about what's going to kill us, what could go wrong here.
Oh
Even
yeah. Well, I asked the questions, but I was in there asking the nurse.
oh yeah,
So, and
oh,
I
yeah.
knew that she worked full time at a
Yes.
university hospital in
Mhm.
the critical care unit, and this was her part-time extra PRN job.
Yeah.
She just liked it because it was non-stressful and it was
See?
fun, something extra, but she had the credentials of someone that I trusted to. I mean,
Right.
started an IV like that. I mean, she was good.
And see, to ask, and
Hmm.
that would reassure me as well. If she's saying,
Hmm.
"Girl, I work at KU. This is just
Yeah,
some
yeah,
side bills," I'd be
yeah,
like,
yeah,
"Okay, get your money. Here's the
yeah,
IP."
yeah,
Like we would
yeah.
do that. But I think if the businesses, if they proactively would put that information out there, it may open up your clientele as well for us who are registered nurses or in the healthcare field to feel more comfortable going. And just for
Mhm.
your own, safety, like you're mentioning, the FDA approval, we don't know how these things will be regulated in the future. So to kind of be ahead of that curve, I think would be
Right,
great.
right.
Mm.
Well, I thought this was a great topic. I'm glad we got to cover it because
Yeah.
it's something that I've wondered about. How do other nurses feel about it? So I think this is good if we have nurses listening to the podcast, anybody that can chime in and say what their thoughts are on this, because I've heard so many different opinions from different places. The majority of nurses are a little leery of it just because we know the
Mhm.
risks, but I'd love to hear all the opinions.
Oh yeah, definitely. So what do we think in these last few moments? What would be our takeaways for kind of lay people, non-medical people?
I would say the takeaway from this hydration new craze is that from a medical standpoint, I don't feel that there is a huge risk to doing it. I think the risk is minimal, but I don't see the benefit either.
Mhm.
I see the benefit when it comes to the hangovers.
Okay.
I see the benefit when it comes to quick hydration. When you are, like I said, partying too hard in Vegas and
Mhm.
need that quick hydration, I see the benefit. I know it works. It works fast. Again,
Mhm.
you could get it from Pedialyte, Propel, Gatorade, but it's going to take a long time and you're probably nauseous and throwing up from your hangover that you're not
Yeah.
going to want to keep that down.
Yeah.
So this is the way to go.
Yes.
You can afford it. If you budget it into your vacation budgeting plan, gonna need some IV. If you plan on going hard on the drinks, do it.
Yeah.
So I think that's great. I mean, honestly, there's not a lot of downside to it. It's just be mindful and be educated on what they're selling you.
Mhm.
And is it something that you could get with your insurance and with a small copay and do it? Or is it something worth paying another couple $100 or having a membership somewhere? You need to know what the benefits are. Because like I said, I think the risks are very minimal.
Okay. I agree with you on that. And I think to add on top of that, because we do stress preventative health care, I would say after you do it, at some point, go check in with your doctor. Just to, we should be checking in periodically anyway, but especially if if this is something that you're engaging in, just to make sure from a lab values perspective that everything is okay and that nothing is off. Because we know that, it's little differences in the vitamins.
Mm-hmm.
And even, I had a patient one time, she had almost no vitamin A and it was affecting her vision. She was almost legally blind. Like these vitamins, even though we think that if we do not know what they do in our body, they absolutely play a role. So I
Yeah.
would say just kind of in using that at some point, go get checked out by a doctor and let he or she know what you're doing. Like just be honest and say, hey,
Yeah.
I get drunk or I'm doing the NAD. What is your opinion?
Yeah. Just
Be
tell
frank.
them.
We grown.
Yeah.
We know what we do.
And doctors aren't going to judge you. Believe me, they've
Right.
done worse. Someone came in and told them they just, did a plethora of drugs the night before, but we need to know that so we know how to treat you.
Yes.
A nurse needs to know, a doctor needs to know. I tell my doctor, yeah, I was not feeling good this weekend. I went to one of those IV fluid places because I was not coming into the ER because I didn't want to wait. And I think it's a waste of time coming into the ER. And I already know how much ER visits cost too. You know
Right.
what I mean? So at the end of the day, this might have been cheaper in the
Yeah.
long run for me.
Mm-hmm.
So, you know what I mean? It's just something you got to think about. But if I would have waited the next week when I wasn't feeling good still, I waited till Monday. I called my doctor. They called me in an order at the infusion clinic, and I went there, no copay, and got 2 liters of fluid, not just one. So that it was just because it was a Monday. The only reason I went was it was a weekend, and I just refused to go to that ER.
Yeah.
And like I said, that I probably made out paying less by the
Yeah.
time I get that ER bill with my copay and all that.
Yeah.
So, I think as long as you have the information, the knowledge, and you can sit back and evaluate it and compare pros and cons and know, educate yourself on your labs, go with your doctor. Like I'm telling you, I see a doctor, I know I know my vitamin D is low. It's always low, and I know, so I can always take some extra vitamin D. It's not going to hurt me. I can always take that. So it's good to know those kind of things. So those are the biggest takeaways from, I think, what we talked about today.
Okay, I agree. This is a good topic.
Yep. I'm just curious, and I want to know what other people have to think about it.
Well, hopefully they'll post in the comments.
I hope so. I want to see some comments. I want to see some
Definitely.
comments.
Yes, yeah. Well, thank you. Well, Lisa, I
Okay.
think this is it for us for this episode, and definitely everyone check back in with us soon on our
Yep.
next. And let us know what
Bye.
you want to hear.
I
So
know. Let us know. Let us know what other topics you want to hear. And all the nurses out there, give us your opinions. We want to know.
waiting on it. Yes, thank you.
Okay. Bye, everyone.
Bye.